This is Deborah Baker with the CISO Guide to Cyber Resilience podcast. Hi, this is Deborah Baker with Trusted CISO, and today we are covering the latest on the Change Healthcare attack. In today's session, we'll explore a CISO Guide to Cyber Resilience, a comprehensive how-to guide for every CISO and security engineer that wants to build a resilient security program. This guide is essential, especially in the wake of significant cyber incidents like the Change Healthcare hack. In February 2024, Change Healthcare, a subsidiary of UnitedHealth Group, faced a significant security breach. According to Bleeping Computer, nearly a third of all Americans' health data may have been exposed during this attack. Let's delve into the details of what happened. Change Healthcare is a leading health payment processing company that handles about 15 billion medical claims annually, accounting for nearly 40% of all claims in the United States. The breach impacted a vast amount of sensitive data due to the company's extensive reach in the healthcare sector. The breach occurred when the ALPHV ransomware gang exploited a Citrix server that was not configured with multi-factor authentication. The attacker stole the username and password it had previously been stolen. This allowed them to gain unauthorized access to the network and deploy the ransomware. Now, one thing I wanted to point out is when this was first reported on, they said that the Citrix server had not been patched. But now the story's been corrected and they're saying that the Citrix server did not have multi-factor authentication configured. As a result, Change Healthcare had to shut down its systems, causing widespread delays in prescription fulfillment, surgeries, and payments to doctors. The attack severely disrupted healthcare services, highlighting the critical need for robust cybersecurity measures in healthcare and in all industries. The attackers managed to steal a significant amount of sensitive information, including personal details like names, addresses, dates of birth, government IDs such as Social Security numbers, driver's licenses, and passports, as well as medical records. In addition to personal information, the attackers also access health insurance details, billing and payment data, and guarantor of information for healthcare bills. This breadth of stolen data poses severe risks to affected individuals. The review of the stolen data is in its late stages, and more affected individuals may be identified. Notifications to those impacted are expected to start in late July, providing guidance on how to protect themselves. UnitedHealth reportedly paid at least one ransom to the ALPHV group, and additional demands were made by Ransom Hub. These ransom negotiations have significant consequences, including potential further exposure of sensitive data. Ransom Hub has published some files on the dark web and threatened to sell the data to the highest bidder, indicating an ongoing risk of data exposure despite ransom payments. To protect yourself, change your passwords at least annually and make sure that if there is a breach, that you do change your password. Also use a password manager such as Bitwarden, LastPass, or 1Password, and ensure your passwords are strong and unique for each site. Always enable multi-factor authentication to add an extra layer of security, because that would have protected Change Healthcare in this instance. Multi-factor authentication involves using something you know, like a password, something you have, such as a token or PIN code, also mobile device, and something you are, like biometric data, your face scan or fingerprint. This significantly enhances security. MFA can block over 99.9% of account compromise attacks, making it a critical component of any company's security strategy. As we wrap up, remember that cyber resilience isn't about if, but when an attack will happen. Will your organization be ready? Equip yourself with the knowledge and tools to transform your network to be cyber resilient. Thanks for listening.